Let us now learn about profunda femoris artery. Profunda femoris artery is largest branch of femoral artery. Profunda femoris artery is largest branch of femoral artery. It is chief source of blood supply to muscles of thigh. Profunda femoris artery supplies muscles of all the compartments of thigh. Hence, it is chief source of blood supply to muscles of thigh. It arises from posterior lateral aspect of femoral artery, about 3.5 centimeters below the inguinal ligament. Profunda femoris artery arises from posterior lateral aspect of femoral artery, about 3.5 centimeters below inguinal ligament. You can say this is inguinal ligament. 3.5 centimeters below the inguinal ligament, profunda femoris artery arises. Profunda femoris artery gives lateral circumflex femoral artery, medial circumflex femoral artery, perforating branches, and muscular branches. Lateral circumflex femoral artery, medial circumflex femoral artery, perforating branches, and muscular branches. Course of profunda femoris artery. As the artery descends, it passes posterior to femoral vessels. Profunda femoris artery, as it descends, it passes posterior to femoral vessels. Continuing downwards, it first passes between adductor brevis and adductor longus. Profunda femoris artery continuing downwards, it passes between adductor brevis and adductor longus. It then passes between adductor magnus and adductor longus. Its terminal part pierces adductor magnus to anastomose with upper muscular branches of popliteal artery. Its terminal part pierces adductor magnus and anastomoses with upper muscular branches of popliteal artery. Now let's see each branch in detail. Lateral circumflex femoral artery. Lateral circumflex femoral artery passes between anterior and posterior divisions of femoral nerve. Lateral circumflex femoral artery gives three branches: ascending branch, transverse branch, descending branch. Ascending, descending, transverse. Medial circumflex femoral artery. It disappears from the femoral triangle by passing between psoas major and pectineus. It also gives three branches. It first gives acetabular branch and then it divides into ascending and transverse branches. Acetabular branch, ascending branch, transverse branch. Here we get descending branch, here we get acetabular branch. Profunda femoris artery gives four perforating arteries. You can see four perforating arteries. They are numbered from above downwards as first, second, third, and fourth. They are numbered from above downwards as first, second, third, fourth. Profunda femoris artery terminates as fourth perforating artery. Profunda femoris artery terminates as fourth perforating artery. Anastomosis on the back of thigh. The back of thigh is supplied by three arterial anastomosis: trochanteric, cruciate, and longitudinal anastomosis. Trochanteric anastomosis, cruciate anastomosis, and longitudinal anastomosis. Longitudinal anastomosis. It is located near linea aspera. It is present along insertion of adductor magnus. It is formed by following arteries: ascending and descending branches of four perforating arteries. Superior muscular branch of popliteal artery. You can see ascending and descending branches of four perforating arteries and superior muscular branch of popliteal artery. Descending branch of fourth perforating artery anastomosis with superior muscular branch of popliteal artery. Ascending branch of first perforating artery takes part in cruciate anastomosis. Trochanteric anastomosis. It is situated near trochanteric fossa. It is formed by two descending branches and two ascending branches. Ascending branch of medial circumflex femoral artery, ascending branch of lateral circumflex femoral artery. Ascending branch of medial circumflex femoral artery, ascending branch of lateral circumflex femoral artery, descending branch of inferior and superior gluteal arteries, descending branch of inferior gluteal artery, descending branch of superior gluteal artery, descending branches of gluteal arteries, ascending branches of circumflex femoral arteries, descending branch of inferior gluteal artery and superior gluteal artery, ascending branch of medial circumflex femoral artery and lateral circumflex femoral artery. Cruciate anastomosis. It is situated at the upper part of back of femur at the level of lesser trochanter. Situated at the level of lesser trochanter. It is formed by following arteries. It is formed by two transverse branches, one descending branch and one ascending branch. Descending branch of inferior gluteal artery. descending branch of inferior gluteal artery. Transverse branches of medial circumflex femoral artery and lateral circumflex femoral artery. Transverse branches of medial circumflex femoral artery and lateral circumflex femoral artery. Ascending branch of first perforating artery. Let us now revise branches of profunda femoris artery. Profunda femoris artery gives lateral circumflex femoral artery, which gives three branches: ascending branch, transverse branch, descending branch. Medial circumflex femoral artery also gives three branches: acetabular branch, ascending branch, transverse branch. It gives four perforating arteries and muscular branches. Anastomosis on back of thigh: longitudinal anastomosis, trochanteric anastomosis, cruciate anastomosis. Longitudinal anastomosis is formed by following arteries: ascending and descending branches of four perforating arteries and superior muscular branch of popliteal artery. Ascending branch of first perforating artery takes part in cruciate anastomosis. Trochanteric anastomosis. It is formed by two descending arteries and two ascending branches. Two descending branches are descending branch of inferior gluteal artery, superior gluteal artery. Ascending branches of medial circumflex femoral artery and lateral circumflex femoral artery. Cruciate anastomosis. It is formed by two transverse branches, one descending branch and one ascending branch. Transverse branches of medial circumflex femoral artery and lateral circumflex femoral artery. Descending branch of inferior gluteal artery. Ascending branch of first perforating artery.